The next session is with our speaker, Dr. Milli Shah. All right. Dr. Milli Shah, welcome to the conference. Allow me to give your introduction. So, Dr. Milli Shah is a leading expert in ozone therapy with over 18 years of experiencing revolutionizing cancer care and chronic disease management. She's the president of the Ozone Forum of India and also the author of the first book on ozone therapy in the country. Dr. Shah has pioneered the use of ozone to treat cancer, chronic illnesses, and pain, and her work focuses on the holistic approach of reversing hypoxia in cancer patients, which is offering a promising pathway to healing. So today, she's here to share her insights and on how ozone therapy is shaping the future of integrative medicine. So please welcome Dr. Milli Shah. Thank you for being there, Dr. Shah.
Yeah, good afternoon, everyone. And, thank you, Amarjeet. Okay.
Yes.
Thank you, Amarjeet, for the uh, lovely introduction. I'll be able
You
to
can
share my.
Yes, yes. You will share button. You can click on it and you can share your screen. You can present
Okay.
your slide.
Yes. Um, Good afternoon, everyone. IFM Conference 2024. I've been always part of this conference, and thank you, Preeti, for inviting me to give this lecture. I've been working in the field of integrated oncology for last 15 years, and I can share some insight of ozone and how to correct the hypoxia with ozone, and what is the correlation between hypoxia and cancer. So hypoxia and cancer heal with ozone therapy is the topic of today, and the presentation lays out the basis of why we are using ozone therapy. Okay, so way back in 2007, when I used to work with an oncoradiologist to prove that ozone therapy works in cancer, we used to get patients who were post-operative and who had risk of recurrence, who are undergoing radiation, and radiation, which is also causing hypoxia, and the why radiation sometimes don't work. Also, patients with tumor recurrence, patients who are suffering with side effects of conventional medicine, and many more. So these are the main target or patients who come to us, and this is a reality check. 1 in 10 Indians to get cancer in their lifetime. Also, in 2020, there was a article by WHO that there can be a rampant increase in cancer cases, which is called a turbo cancer, which could be after certain medication, after the vaccination, and so on. We are in 2000, we are nearing to 2025, and we need a concrete solution towards improving in how to reach or how to improve the cancer treatment modalities. So the main culprit for today is turbo cancer, or the cancers nowadays is the environment and cancer. Who are susceptible? People who are leading a junk lifestyle, which I think many of the our patients do, um, who have genetic traits, ethnicity, but who have more carcinogens in their system. Environmental carcinogens, that is polycyclic aromatic hydrocarbons, aromatic amines, also the genetic tendency towards it makes cancer more, more and more coming up at the surface. Dramatic rise in cancer in last 50 years is also a study. Researchers from Brigham Women's Hospital revealed that the incidence of early onset of cancer, including breast, colon, esophagus, and kidney, are dramatically in rise because of environmental reasons. And at the same time, after post vaccination, we see a lot of them. The main reason for cancer could be radiation, exposomes. Basically, we are exposed to air and water pollution. We are exposed to different diets, which we were not traditionally built for or genetically built for. Drugs, which are xenobiotics, you can say antibiotic, rampant use of antibiotics. At the same time, inflammation, lipid peroxidation, oxidative stress, altered gut flora, stress. These are all exposomes which we tend to neglect, or the patient doesn't understand these can be carcinogens. And the main important, this hypoxia is a hallmark of the tumor microenvironment, which contributes to tumor malignant phenotype. Hypoxia inducible factor is a master regulator into hypoxia mediated pathophysiological changes in tumor. It also leads to epigenetic reprogramming. pH homeostasis is changed, cell migration invasion is changed, pluripotency and therapy resistance. There are multiple reasons why you can have hypoxia inducible factor high in your body, and that can lead to a switch change in your cell metabolism, and that can lead to more and more cancer occurrence. So, a connection between hypoxia and cancer. Way back in 1940 and 1932, Dr. Otto Warburg won a Nobel Prize in proving that lack of oxygen promoted carcinogens, uh, and reintroduction of oxygen can reverse the carcinogenesis. So, if you have lack of oxygen to a particular cell, it changes the switch to only multiplication and tends to keep multiplying. If you re-establish or make the body normoxic, you can improve and reduce carcinogenesis. So this is the key to improve ozone therapy as a key treatment for cancer, which are at the tumor hypoxia level. Cancer cells do not have the same metabolic flexibility as the healthy ones. Mitochondrial damage happens first, that triggers the nuclear genetic mutation leading to cancer. Tumor hypoxia develops due to uncontrolled cell proliferation, metabolism, and abnormal tumor blood vessels, resulting in less transport of oxygen and nutrient. Hypoxia is the main reason why the solid tumors have shown poor prognosis in cancer patients. So, if you see on the right side of your this thing, the hypoxia cells are the cancer cells are basically hypoxic. At the base, there is oxygenation, then there is hypoxia, and then there is necrosis. Whatever solid tumors you are targeting, you are reaching only to necrotic cells and not reaching the hypoxia. And at the same time, there is lack of oxygen and nutrients from the circulation. There's only the glucose metabolism happening in the cancer cell. If you measure a PO2 of your cancer cells, which will be only up to 2 to 10 mm of Hg, whereas your normal cells are functioning at 40 to 45 mm of Hg. So the average partial oxygen pressure of the cancer cells is very low, and that is the reason why you have less results with chemo radiation, because they also create a lot of ROS, and they also create a lot of scarring and burning, and that also leads to necrosis. So it's a vicious circle. Lack of circulation leading to hypoxia, leading to necrosis. When you are targeting to the treatment, it is working only on necrosis and not improving the circulation and not reducing the hypoxia. So it's a circle which keeps going on in the treatment. We know that, or we think that the main reason for any cancer is genetic. But we also now broadly categorize that a lot of cancers can have origin as in viral, chemical, physical, and inflammatory exposure. And these etiological factors can lead to chemical, physical, and inflammatory changes. And that leads to genomic damage. And that is the main reason for the development of cancer. Reactive oxygen species are also involved in diversity of phenomena in treatment. When there is uncontrolled ROS or excessive ROS, there is cellular injury, which is mainly to protein and lipid membrane. This ROS can lead to lot of different stress on the body's defense mechanism, and that is the reason why you have rampant increase in cancer in because of environmental. The origin of cancer is varied, not only genetic, it is also viral, chemical, inflammation. And what are we doing? We are doing main conventional treatment as chemo, radiation, and surgery, right? So if you look at this tree, radiation is targeting the top of the cancer. Chemotherapy goes little deeper and at the same but it is still not addressing the root cause. Surgery will take the trunk of the tree out, but still the roots are still there. And the soil is not the fertile soil. There is no oxygen and no nutrient delivery. And this cancer stem cell survives, and that is the reason why you keep getting again and again the recurrence. I am just trying to prove the point that the hypoxia is the main reason for cancer recurrence. If you don't correct the hypoxia, you will be having a recurrence rampantly you will see rampant recurrence in the patient. Coming to ozone therapy, ozone is a combination of 99.5% to 95% of oxygen and 0.5 to 5% of ozone. When you give ozone therapy, you will always lead to oxygenation and oxidation. So, oxygenation will reverse the generalized anaerobic respiration of the body to aerobic respiration. If you have aerobic respiration, there will be glucose metabolism that will have a better ATP. So, you are having the activated cellular metabolism, modulated immune system, and regulates the antioxidant capacity of the biological system. So when we are looking at ozone therapy, it is not only working on the one way, it works on a holistic approach. So this is a small understanding of how ozone works inside your body. When you give ozone therapy, it is a minute or controlled oxidative stress, repeated oxidation, which leads to enhancement of 4-HNE. Basically, you have 4-HNE and increases the NRF2 pathway. That leads to decrease in nuclear transcription factor. And at the same time, you have better oxygenation, which controls the hypoxia inducible factor by enhancing your vascular endothelial growth factors. When we look at ozone therapy, which can be given systemic, local in a different way in the body, ozone reduces tissue hypoxia, which is the main work. Chronic inflammation can be controlled. Immune system modulation can be seen. Oxidative stress reduction is there. Infection control, it controls the bacterial and viral replication by blowing a hole in bacterial wall of the phospholipid wall of the bacteria. Metabolic control is there. Chemotherapy, radiation side effects can be reduced. Gut flora re-equilibrium will be seen. Dental foci treatment, if you add along with the treatment, that can also improve, reduce the toxin overload from the dental foci and nitric oxide synthesis. So when we give ozone therapy, the fatigue reduction is a universal result. At the same time, healing is improved and well-being is also very much important. So the whole thing, when you give ozone therapy, you get all these holistic symptom reduction. At the same time, ozone can be really, really be helpful as a protective and prevention. So direct effect of ozone or is reactive oxygen species and um, cancer in vitro and vivo. There are a lot of cell line studies and a lot of patient study is done where we see that improved oxygen metabolism is there. Potential upregulation of antioxidant enzyme system is also there. Effect of immune system modulating immunity is seen. There are multiple rat studies that ozone, it shows that ozone can improve radiation outcomes. At the same time, ozone can improve chemotherapy outcomes. Ozone therapy helps in post-operative period of oncology patients, very well seen. And how does it do? So once you give inside the body, ozone inside your body, you will see that ozone enhances the oxygen metabolism at the tissue. It regulates the oxidative stress. Immunomodulator is seen. Metabolic enhancement, and at the same time, it is a wide spectrum germicidal properties. Ozone regulates prostaglandin, so it heals faster. When we give ozone therapy with the RBC's mechanism, we try to enhance the 2,3-DPG production with the help of glycolysis. This 2,3-DPG is a key molecule to release more oxygen at the tissue level. So when you give ozone therapy along with RBC's mechanism, you will see that it enhances oxygen delivery at the cell, means there is a oxygen partial pressure is increased inside the body. So oxygenation is better. And this is proved by a computed tomography that the pre-ozone brain blood flow, this was a case for the tumor glioblastoma, where we saw that pre-ozone, the blood flow to the brain was 80 to 60%, whereas after ozone therapy, in 3 sessions of major auto, the brain blood flow was 100 to 90. So it showed better oxygenation and in control. With WBC, ozone therapy helps in immune modulating by interferon increase. Tumor necrosis factor is also increased. At the same time, it enhances IL-2, which improves in improved inflammatory response. It also enhances IgE reduction. So IgE reduction improves lung function. So there is a better tissue oxygen absorption also. At the same time, ozone enhances macrophagic activity, and that leads to better phagocytosis. So the main target or the main work of ozone happens in the monocytes and lymphocytes, where ozone enhances the interferon production, tumor necrosis factor alpha is also improved, and the gene regulatory cells are also better. So when you give ozone therapy, we achieve something called immune modulation. At the same time, by giving ozone therapy, there is a potential upregulation of antioxidant enzyme system. So when you have ozone therapy given through RBC's mechanism, it will have a better synthesis of glutathione peroxidase and superoxide dismutase. When you have better antioxidant defense mechanism, the disease fighting capacity of the body enhances naturally, and that is the wonderful reason with ozone you can achieve. There is powerful germicidal role of ozone. So ozone, if you use externally or if it comes in contact of any antimicrobial, so any microbes, it has antimicrobial result. So it destroys a phospholipid bilayer of the microorganism. That leads to reduction in the replication of the infection, and that is also a very good wonder. So because many a times when we see the patients of cancer, they are having infection. And that infection their body cannot get rid of because of the lack of phagocytosis or the lack of WBCs in action. So when you give ozone therapy, we are improving the phagocytosis. We are improving the bactericidal property by down regulation of the replication, by down regulation of the viral replication. Type 1 interferon and protein signal will be seen. Also, we have immune cell recruitment for improving phagocytosis. And at the same time, ozone can enhance the work holistically by reducing the replication. So, what do we do for these patients? We do Ozone's protocol is we have to eliminate waste, regenerate the liver, reactivate your immune system, and restore the enzyme and mineral and hormone. How do we achieve this? This we achieve by ozone therapy. We also some occasionally add high dose of vitamin C. If the patient denies to take chemo and radiation, then we add vitamin C and nutritional support. We move on to whole plant-based food diet. Infrared sauna and CBD are also important for endocannabinoid system. So this is an holistic approach, but cancer can reduce hypoxia, and that is the main key for other treatments to work. Because if there is hypoxia, you will not able to get the to the cancer stem cell, and that cancer stem cell, if it is not there, means you are not able to treat the root of the disease. And that is the reason ozone therapy is rated first in, or you can do yoga, or you can do nadi shodhan pranayam. You have to have some oxygenation for these patients, for cancer to reduce the hypoxia. When we are looking at ozone therapy, the administration can be through rectal ear vaginal insufflation. Rectal ear vaginal can be very well combined with minor auto, because rectal works in systemic, minor will work on maintaining or improving your cell mediated immunity. Major autohemotherapy is blood ozonization, which will work on a holistic and improving oxygen to the oxygen generation or circulation to the all the full body parts. Intratumor injection, if you're suggesting or the patient is going for chemo or radiation, so specifically radiation, we do intratumor injection, improve oxygen delivery, and then send them for radiation. If there is oxygen in the cell, the radiation uptake will be fast and the patients reduce with, or patient's radiation is successful. We have done many research in this. The treatment option for us is major auto, minor auto, intramuscular, rectal, or intravenous saline. So this is in way back in June 2007 to February 2008. We did 83 patients of different cancer, which is oral, throat, GI tract. You can do liver, gynec. We've done many. 80% of these patients were undergoing radiation, and 20 were not taking radiation. They were not able to take. We gave ozone therapy as rectal, minor, and ear insufflation, and improved their energy levels. Feeling of cheerfulness was there.
Just now had
Appetite. Pardon?
Apologies for the same. There was someone on mute. You
Okay.
can ignore.
Improved WBC, RBC, and hemoglobin levels. At the same time, the tumor markers were reduced after ozone therapy. So the CEA alpha fetoprotein, CA125, we see that reduction very well with ozone. Supplemental ozone. So after that first work in 2007 to 2008, after we saw that the improvement was very well seen in the patients, and also they did not succumb to the radiation side effect. Post that, for 2 years, we did 133 patients who were all taking ozone therapy as an adjuvant. Here, we had opened up the criteria. We took all the patients who were under chemo or radiation or standalone. The idea was to add ozone and see the result, and this showed very good ozone result, because there completion of the treatment was seen very well, and this could support them for physical activity, for mental well-being, and also for reducing the recurrence of the patients. So I just wanted to show a few cases. So this is a initial and final. This is breast cancer patient where we did ozone injections, intra-tumor injections. At the same time, we did funneling over the tumor, and it reduced the tumor load, and she could take that chemotherapy also better. This was again a rectal anus tumor, was seen that, in 10 days of local healing application, it really improved. So the aim of ozone in cancer, that is effective and safe adjuvant treatment. It does not replace chemo and radiation. It enhances efficacy and decreases the side effect of radiation. It can be used alone if other treatment cannot be used. So today, I would promote that you need to have an integrated approach in combining conventional treatment along with ozone, nutrition, environmental therapy. And this is a patient centric, personalized treatment. You can really improve the outcomes of the treatment with cancer. And my motto is I want to unify the healing world with ozone therapy. I would also welcome you for our upcoming next conference, which is on 8th and 9th of February in 2025 in Mumbai. And the topic is Ozone and Longevity Healing Festival. The idea of keeping a healing festival, why should we just keep talking about the disease? We should also talk about healing and celebrate it. Thank you very much. And I think I finished just 23 seconds before my lecture to be ended. Thank
Excellent
you.
timing and an excellent presentation. I could see so many thumbs ups and I could see so many people actually giving those hearts as well. So, if you really
Thank you.
appreciate, dear participants, the speakers have taken out their valuable time and are giving brilliant presentations with their expertise. I'm just going to close this timer. Just give me a minute. Apologies for that. So, that was for
Okay.
me, probably. Thank you so
Yeah.
much once again, Dr. Shah.
Thank
And
you. Thank
I'll
you.
just quickly take a question. There was a question in the chat box. I'm taking the last question. It says, how can we ozonize ourselves naturally? Are there any specific types of pranayams?
Okay. So you can naturally have ozone in your breathing, where if you walk at the seashore, okay. Yeah. So many of a few of my friends who I have seen, the internationally, if they have patients, they tell them to just go and spend some 2, 3 months near the seashore along with the treatment. So that is like if they don't want to take ozone. Naturally, there is no ozonization. You can do it like in a morning pradakshina around the tulsi. Tulsi plant is known to give ozone in a minute quantities. So आप उसके आजू बाजू प्रदक्षिणा कर सकते हैं, but that is like a very very low level. Pranayam, which are very good, is Nadi Shodhan Pranayam. That is oxygenation and not ozonization. Nadi Shodhan Pranayam is that you inhale, hold, and exhale. So inhale for 4, hold for 8, and exhale for 8. That is the Nadi Shodhan Pranayam. That can really oxygenate your body but not ozonate. Ideally, we have trained so many doctors, and IFM has many doctors who've already practicing ozone. So you should go to them and take treatment. I see Dr. Pankaj, I see Dr. Samir. Many are there. So I will also recommend go and take treatment from them. That will be wonderful.
Very, very beautiful and actionable insights that you have given. I'm pretty sure that the participants are trying to absorb everything like a sponge today. Brilliant insights from all the speakers. Thank you so much for being here, Dr. Shah, once again.